Hello guys, welcome back to my channel. Dandio here. If you're new here, I would like to welcome you to my channel, and I want you to take a moment and hit the subscribe button so that we can grow this channel together. So if this is your first time tuning in for Medtalk, this is Medtalk. Here we'll be describing various disease conditions, and I'll be giving you some medical tips as well. Remember that the things that I talk about here is to just educate you and also create awareness to some disease conditions. Some people would want to wait till some conditions are at their worst state before they will go to the doctor. So if you are educated about these conditions, you become aware of these disease conditions and get help as soon as possible. And that is why Medtalk is the show for you. So stay tuned. So as you already know the title of this video, not every headache is migraine. Note that. So in this video, what we'll be looking at is what is headache, the types of headache in relation to their localization. That is exact points where the headache is, whether it's on one side or both sides, the description of the headache itself and its nature, and the duration of the headache, and we'll be looking at the management of the various types of headaches as well. So without further ado, let's move straight into what headache is. So what is headache? So headache can be described as any pain originating from the head due to an irritation from either intracranial structures or extracranial structures. Let me break it down. So when we say intracranial, it means that every structure in the cranium, and when we say extracranial, it means that structures outside the cranium. So if you may be watching and you don't know what cranium is, so cranium is part of the skull, and you know the skull makes up the whole head bone. So the cranium is the non-movable part of the skull. So here are images of the cranium. That is the part of the skull that actually covers the brain. So all these structures in the cranium are the structures called the intracranial structures. So it means that all the structures outside the cranium are the extracranial structures. So these structures can be the skin, the muscles, and the blood vessels outside the cranium. So then we go back to our definition of headache, which is pain originating from the head as a result of irritation of either intracranial or extracranial structures. So one of the most important part of the intracranial structures that is mostly irritated is the cranial nerves. So as we go on today, you get to know why I said that. So the types of headache. So the first type of headache we want to talk about is cluster headache. So this type of headache is unilateral. Unilateral meaning that it's on one side of the head. So meaning that if you're having headache which is on both sides of the head, it is not a cluster headache, because cluster headaches are on one side of the head. So the duration or the time that this headache lasts is about 15 minutes to 3 hours. And remember that this type of headache is repetitive. So mostly the region which the headache is around what we call the periorbital region. That is the area around the eye. So it actually gives a periorbital pain. That is pain around the eye. So this pain is very severe. Usually is actually termed as a suicide headache. So you can actually tell how severe the pain is. Again, the headache is actually accompanied by what we call lacrimation. Lacrimation is tearing, and rhinorrhea. Rhinorrhea is nasal discharge. All these that I've mentioned are features of cluster headache. So if you are experiencing a headache that you have all these features that I've actually mentioned so far, that is cluster headache. So the exact cause of this headache is said to be unknown, but then some researchers have actually linked it to the change in seasons and times and change in sleep cycles as well. So I'll actually leave the link to these articles in the description box below. So I'm not going to go deep into the management of these types of headaches, because when you're experiencing these types of headache, what you're supposed to do is to get to your doctor for him to ascertain the cause of headache and treat you accordingly. So what I'm going to do is that I'm just going to mention some of the management of these types of headaches. So the management. So some of the managements are inhaling of high intranasal oxygen through mask. Also, a class of drug that may be prescribed to you by your doctor is sumatriptan, which is a class of drug that we use to manage cluster headache. So another type of drug is verapamil. So what we use verapamil is for as a prophylaxis. So remember that I said a cluster headache is repetitive. It's actually given to prevent occurrences and other episodes of the cluster headache. So that's why we give verapamil as a prophylaxis. So that is cluster headache in a nutshell. So the next type of headache is what we call tension headache. So first, let's look at the localization of tension headache. So tension headache is, remember that it is bilateral, it's not on one side as cluster headache. It is bilateral, meaning that it's on both sides of the head. So the duration, it usually lasts about 30 minutes, typically 4 to 6 hours constant. So this type of headache is constant. So here's a picture showing you tension headache. So the red portion is actually indicating where the pain is normally found. So the cause of this headache is found to be as a result of the contraction of the muscles of the scalp, which is due to some triggers. So some of the triggers are physical or emotional stress, alcohol use, caffeine, colds or sinus infection, dental problems, example bruxism. So bruxism is grinding of the teeth during stress or anxious states. Remember, this grinding of the teeth is unconscious and it usually comes during stressful or anxious states. Also eye strain and excessive smoking. So all these are triggers of tension headache. So then management of tension headache. Remember, the management of tension headache is based on the removal of the triggers. So here the doctor is supposed to take a history and ascertain what is actually causing the headache or what is actually triggering the tension headache. When that trigger is removed, the tension headache will eventually stop. So other managements that we use are NSAIDs. So NSAIDs are painkillers. So these are some of the managements of tension headaches. So the last type of headache that we mostly abuse its name is migraine. So today you're going to learn what migraine is so that you won't classify all headaches as migraine. So let's look at the features of migraine. So the localization of migraine. So migraine is unilateral, meaning that it's also on one side of the head, usually lasting about 4 to 72 hours. So the classic description of migraine pain is a pulsating pain which is accompanied by nausea, that is feeling of vomiting, and also aggravated by what we call photophobia, that is the fear of light. Also phonophobia, which is a persistent abnormal fear of sound. Remember that these sounds are normal sounds, but when you're having migraine, you begin to have this abnormal fear of these normal sounds. So some of these normal sounds are from car horns, door closing, and even normal noise from the kitchen, which may be coming together of utensils or cutleries. So you could actually see that all these are normal sounds, but when patients have migraine, these sounds become abnormal to them. Also with migraine, there are some things that actually happen about 20 minutes or even an hour before the pain, which are termed as aura. So research have actually shown that about 20% of people who experience migraine experience aura before the migraine pain itself. So some patients actually see sparks or flashes of light which are not even there. But because you are having this aura, they'll be seeing all these sparks and flashes of light. And some people even go on to even lose their vision temporarily during this time of aura. So the next aura is tingling and numbness of the hands and feet. And the last type of migraine aura is the paralysis of one side of the face. So all these are auras of migraine. And remember that they happen before the migraine itself. So then what causes migraine? So the exact cause of migraine is not known, but they are also said to be as a result of the abnormality of the brain, temporarily affecting the nerves and the blood vessels of the brain. And that is what researchers have actually linked it to, but the exact cause really is unknown. So for acute migraine, what we use is analgesics, what you call painkillers. Some doctors will also like to prescribe TCAs such as amitriptyline for their patients. But remember that for prophylaxis, there are also lifestyle changes that you can also do to prevent migraine. Some lifestyle changes are getting enough sleep and also exercising as well. So apart from these three types of headache, there are various causes of headaches. Examples are hypertension, anemia, dehydration as well. So that's why you shouldn't take headache for granted. Every headache has its own cause. So now you know why not all headaches are migraines. Migraine is a type of headache. So this is where we draw the curtain for today's Med Talk. And I hope you've learned a lot from this video. If you have, also give a thumbs up by liking the video. And remember to share the video and educate someone. My name is Dandio and this has been Med Talk. Thank you all for watching and see you in the next one.